Okay, doctor, let's go get to somewhere that we can talk perfectly and comfortably. I'll start the conversation and then we can talk detail.
Okay, let's do it.
Excuse me, Mrs. Tesalonika. Good morning, Mrs. Tesalonika. I'm Gwen, your nurse for today, and this is Dr. Anastasia. We were here to talk about your condition for today. We want to talk to you around 15 until 20 minutes. And if you feel tired, you can tell me and we can adjust a time for you. Do you agree with that? Okay, Mrs. Tesalonika. Would you like your husband and your daughter to stay while we talk?
Yeah, I don't know.
Yeah, of course, me and my daughter will stay here.
Okay, thank you, Mr. Marco and Chiesa. Your support and presence is really important for her.
Excuse me, Mrs. Tesalonika, can we sit there? Okay, we are sitting here so we can talk comfortably and safely. First, we want to know about your feeling. Then, with Dr. Anastasia, we want to about your condition and your continued treatment.
Okay, before we explain more about your illness, Ms. Tesalonika, may I ask you what you understand about your illness and treatment you've been told so far?
I know that I have breast cancer and I have 8 rounds of chemotherapy, and I know that's a part of my treatment for breast cancer. But honestly, I hope that this treatment could be the last one because I'm so tired for being back and forth to the hospital.
Yeah, she often said that she's really exhausted when we are going for chemo checkups. It really drains her energy.
Yeah, I heard Mama say that too. Instead, she will come again and again to the hospital. She's preferred to take a rest at home. To be honest, I totally worry about my mama condition because honestly, I don't want to see my mama get weaker.
Chiesa, don't you want to buy something with your grandmother?
Oh yeah, sure. I will bring some later.
So, Mrs. Tesalonika, you really understand about the chemotherapy, that the important treatment for your illness, but you also feel exhausted and hope this is the last cycle for your treatment. And your husband and your doctor told that the treatment is drain your strength.
Yeah, I know this situation is very hard for you, and I want to explain. Chemotherapy is very tough and it's like never ends. And I want to explain about the number cycle of chemotherapy is different for every patient. It depends on your body response and what you are doing for your healthy when you go after doing the chemotherapy. And I know it isn't easy for you to hear about your chemotherapy and you are already so tired, but we will do our best to help you and you don't have to face this on your own.
Thank you for saying it that way. It helps me a lot.
Thank you for sharing with us, Ms. Tesalonika. I'd like to ask, would you like us to share with you all details about your condition and next steps, or would you prefer that we keep things the general?
I want to know my condition because I rather to know what's happening with me.
Yeah, it's better for us to know what's going on rather than just to know.
That's very nice that you really want to know about your condition, and thank you for sharing and telling us about your feeling. And we can go step by step. And if you need some pause moment, you can tell me.
Okay, I'm ready.
Firstly, we want to say sorry about the news. The news we're about to deliver. It's not really very nice. Based on your last ultrasound test, we see that even the surgery and the many rounds of chemotherapy, there are still some serious problems. The skin around the area has been damaged, and there's a lump in your left arm. This means we need to be very careful, and not only with the illness itself, but also with the pain because of the infection.
So, does this mean the surgery that she went through was not successful?
But also, every step that your wife going through has been meaningful. The surgery, the chemotherapy has been meaningful. That given us information about your wife's condition, about your wife's body response, and it can control her illness. Um, Mrs. Tessa, you really brave. You can going through all the treatment. You have the bravery, and this is not useless because you help us to know your condition very well. I know it's very hard to you, but if you please you can tell us about your condition, so we can step by step help you, and we can really know about your condition and your family. We can solve the right choices for your next care. Mrs. Tesalonika, I can see this is very difficult for you, but can you tell me how do you feel after hearing this news?
I don't want to see my husband so tired because I don't want to look at he to judge me again and again. And I feel guilty. I keep wondering what will happen with my family, especially to my daughter.
So, the heart of your life is not just the illness, but also your thought about your husband, exhaustion, and your daughter's future. You carry many fears and guilt by yourself. But can you tell me a little more about how you see your role in your family?
I feel like I'm a burden because of my illness, so my family have to give much effort for me, and it makes me feel guilty. It makes me feel like I'm just a burden for my family.
She often said that she's exhausted going for checkup to the hospital, but to me she is never a burden. She is my wife.
Thank you for saying that. Your support means a lot. Even though you feel fear and of being burdened, your husband said the opposite. You're still the source of love and still the strength of your family.
Thank you for saying that. It's mean a lot to be heard. Sometimes I just keep it inside. I keep everything inside because I just don't want to be worried for my family.
Okay, Miss Tesalonika, would you like us to talk about your plan to your care right now, or would you prefer to talk it later when you have your more rested?
I want to hear it now, please.
Okay, thank you for your courage in choosing to discuss it now. So here is the medical plan of your start immediately. So we understand you are finished your cycle about your chemotherapy, but it's right the 8 previous rounds of standard chemotherapy. So we appreciate how you are so very strong in difficult time. Now we have a different approach. So this is we introduce gentle chemotherapy medicine. So we also call it maintenance dose. So we are giving this later medicine to you to make your treatment much easier on your body to reduce the severe side effect while keeping it illness stable. So the second is because your pain and the small lump in your arm, so we will add a short focus course of radiation. So we are only aiming the radiation at the small and painful spot. This is combination the gentle chemo and the target radiation. So it's designed to give you the best chance for controlling the symptoms and reducing the pain. And improving your daily life, I know, and we will check how well this new plan is working in about 3 weeks to decide if any medication need to be changed again.
Mrs. Tesalonika, me and my team, we entirely focus on your comfort and your peace. And to manage your pain, to prevent any pain, we're using another medication and then using the simple technique of the treatment for you. And every day we will monitor your wound and take care of your wound to prevent the infection. And also with you and the husband, Mr. Marco, we will provide to support the emotional and practical support for your care.
Yes, nurses, I understand this plan is for the new medication and adding radiation just for the pain, and then the nurses will help me to get more comfortable and also take care of the wound, and it makes me feel less afraid and feel more better.
Okay, Miss Tesalonika, before we finish our discussion, would you have any question for your new chemotherapy, for your new radiation?
No, doctor, I understand this plan completely.